Let's look at how your immune system fights cancer. Your immune system is your body's natural defense against threats like infections and cancer. It consists of cells, tissues, and organs that work together to detect and eliminate harmful invaders. You have a few key immune cells that fight cancer. T cells are white blood cells that can be trained to recognize and attack specific cancer cells. You also have natural killer, or NK cells, which patrol your body and destroy abnormal cells. Lastly, you have dendritic cells, which help direct the immune system response by showing pieces of cancer cells to T cells. Cancer cells can evade the immune system by hiding or activating checkpoint pathways that normally prevent immune cells from attacking healthy cells. Proteins like PD-1 or PD-L1 and CTLA-4 are examples of immune checkpoints that cancer can use to turn off T cells. What are the main types of immunotherapy? One is called checkpoint inhibitors. Checkpoint inhibitors block proteins that act as brakes on the immune system, allowing a stronger response against cancer. These drugs have shown success in treating melanoma, lung cancer, kidney cancer, and others. The benefit of this treatment is that it helps your body recognize and fight cancer cells more effectively, potentially leading to longer-lasting responses compared to traditional treatments. Another option is cellular therapies. These therapies use a patient's own immune cells that are modified or activated in a laboratory to enhance their cancer-fighting abilities. There are a few types. The first is CAR T-cell therapy, where T cells are genetically engineered to recognize specific proteins on cancer cells. Another option is tumor-infiltrating lymphocyte, or TIL therapy. This option uses immune cells already present in tumors. The benefit of this type of treatment is that it can induce long-lasting remissions in patients who haven't responded to conventional treatments. Another treatment option is called bispecific antibodies. These engineered antibodies have two binding sites that can simultaneously attach to cancer cells and immune cells, bringing them together to enhance the immune response. The benefit here is that it can help immune cells recognize cancer cells that previously evaded detection. There are also mRNA cancer vaccines. These vaccines use genetic material, which is the mRNA, to instruct cells to produce proteins similar to those found on cancer cells, triggering an immune response. They can be tailored to target a specific cancer type or genetic makeup in a patient, with generally fewer side effects than traditional vaccines. Lastly, there are combination immunotherapies. Combining different immunotherapies or using immunotherapy with traditional treatments like chemotherapy or radiation can improve effectiveness by targeting multiple pathways simultaneously. There are also practical considerations for patients. For example, cost and insurance. Immunotherapy costs can range from tens to hundreds of thousands of dollars per year. However, most private insurance plans, Medicare and Medicaid, cover FDA-approved immunotherapies. Review your insurance policy and discuss financial concerns with your healthcare team. You can also ask about financial assistance programs offered by hospitals or pharmaceutical companies. If you're interested in accessing new immunotherapy treatments, talk to your oncologist about available clinical trials and search online databases such as clinicaltrials.gov. How can you manage side effects of treatment? Side effects can appear weeks or months after starting treatment. Report any new symptoms to your healthcare team promptly. Most immune-related side effects can be managed effectively if caught early. Remember, there are also excellent support resources available. These include GRACE, of course, but also the Cancer Support Community, the American Cancer Society, and the Society for Immunotherapy of Cancer. Your healthcare team can connect you with counseling, nutrition advice, and financial assistance. It's important to stay informed and ask your healthcare team questions. Some questions you may want to ask include: is immunotherapy appropriate for my type and stage of cancer? What specific type of immunotherapy might work best for me? What are the potential benefits and risks in my case? How will we monitor for and manage side effects? How long will treatment last? And how will we know if it's working? What costs should I expect? And will my insurance cover them? Am I eligible for any clinical trials? Remember, Immunotherapy is a rapidly advancing field with new treatments being developed and approved regularly. Stay in close communication with your healthcare team and don't hesitate to ask questions about your treatment options.